Hello, I'm Miles Price from Life Clinic, and this is Julia Andre, the psychologist for Life Clinic. Today we're going to be talking about PMS, premenstrual syndrome. This is a common condition experienced by women between the ages of 30 and 50 and on around and about during their period. And women experience a range of symptoms. They can experience fatigue, they can experience tension, irritability, mood changes, food cravings, bloating and swelling in their extremities like their ankles or fingers. And these symptoms come and go around about 5-6 days around their period. Typically it occurs when there's a hormonal imbalance going on in the body. And the hormones which control the period are estrogen and progesterone. And what we find is that there are raised levels of estrogen going around the body. And it contributes to these conditions. In particular, it affects the neurochemistry in the brain and it affects the adrenaline and noradrenaline functions. So in terms of managing this from a functional medicine point of view, we have to address the imbalance of progesterone to estrogen and help clear the estrogens out of the body. So why is this occurring in the first place? Well, first of all, there may be a lack of bile flow coming out from the liver. And this is the main excretory pathway by which estrogen is eliminated from the body. So we have to increase the bile flow. Second of all, we have to improve estrogen detoxification itself in the liver. And there's two key pathways of estrogen detoxification, and we have to address both of them. Third, there could be excess estrogen coming in through the diet or from what we're eating. And this is coming from xenoestrogens. So this is coming from plastics, this is coming in the foods and the meats and dairy products, and this is also coming from cosmetics. There's a variety of different xenoestrogens could be getting into the body which increase the total body burden of estrogens. So in terms of treating it, what we have to make sure is increasing the bile flow, reducing the xenoestrogen intake, and making sure the estrogenic pathways are improved. From a dietary perspective, we have to lower our carb intake. So refined carbs, excess carbs, and having more protein and good fats can actually lower the PMS symptoms. And from a psychological point of view, we have to address that because the key elements of the symptoms which women experience are more related to their mood changes during this time. And I'd like to bring in Julia here to talk about that in more detail.
Thank you, Miles. I would like to introduce a case of a 30-year-old woman that particularly has problem 1 week before her period is coming up, and she really feels like an increased sense of irritability and feels actually really on the edge all the time, and also like recently she feels also very anxious, so that she would like not wanting to go out or is very suspicious about her boyfriend and, for example, keeps on checking his phone. And this is coming back basically every month, and after her menstruation it's all pretty much back to normal. And how we address this problem from the psychological point of view is by applying cognitive behavioral therapy. It's also called like CBT. And we particularly worked on different areas. The first one was like more stress and anger management, to realize like what to do when the anger is coming up, to not let it all out. And one way how to target this was assertiveness training. For example, how can she communicate her needs in like a way that it's received well and not ending in a fight. And like one other area we targeted was like identifying like cognitive negative thoughts, basically. They also so-called automatic thoughts, and they very much come and are unnoticed, and very often they have like or include like those unhelpful thinking styles, such as thinking black and white, or applying a mental filter by only focusing on the negative rather than on the positive, or starting doing mind reading. And we would basically all those target during psychotherapy. So that's how we would like target or intervene from the psychological point of view.
That's great. Thank you, Julia. I appreciate that. So we can see a combination of different approaches using psychology, using functional medicine. We can actually address the root causes of PMS and really help women in an integrated way get back to their full health. Thank you very much.